Hi everyone, and welcome to this new live session. Thank you so much, Caroline, for joining us to talk about caseload midwifery. I think it's going to be a very important and helpful session. I'm going to try with a very short introduction. So hi everyone, my name is Carol. I am the founder of Parentally, and we are a platform dedicated to supporting the well-being of new and future parents. And we are here to facilitate access to information, community support, and of course also professional support through our marketplace, where we bring together professionals such as doulas, childbirth instructors, lactation consultants, child sleep coaches, every professional a parent may need to prepare for and navigate the challenges and the beauties of parenthood. So today we're going to talk about caseload midwifery, and just before we get started, this live is recorded, so we will share it on our Instagram feed and also on our YouTube channel. So make sure to subscribe to parentally.nl. And our guest is Caroline Kooij. You are a caseload midwife. I'm very happy to do this session with you. Thank you so much for making the time.
Thank you.
And maybe we can start by an introduction. Would you like to introduce yourself? Tell us what you do and who you are.
Thank you for the invitation. Yeah, I'm Caroline, and I'm a midwife for 21 years now, which of the last 4 years I'm working as a caseload midwife in Amsterdam region at Kairos, and I'm a health scientist as well, mother of 3, and yeah, loving my job.
Awesome. And we're going to talk about actually caseload midwifery, and I believe many parents, many women don't really know what this is. Can you please explain what is a caseload midwife?
Yeah, I think I can do. Actually, the caseload midwife is about how midwives have organized their care compared to the mainstream midwives in the Netherlands. Caseload midwives have really small teams, mostly only 1 midwife or maximum of 2 midwives who are taking care of you the whole journey of pregnancy, birth, and postpartum, which is the main difference. Like the regular practices have on average 5 midwives who take care of you, sometimes 6 or sometimes 4 or 7. And by organizing it on a different way, we succeed to have continuity of caregiver, which has lots of benefits for pregnant women and birth, and gives on average more time in your pregnancy to prepare to dive deeper in certain issues who are in your life. And yeah, so actually the way you organize it makes that the journey of pregnancy and how you give birth is influenced positive.
And Caroline, so for those who are not really familiar with the prenatal care system here in the Netherlands, so you said that it's about the size of the practice, but basically, can you tell us what it looks like in terms of prenatal care compared to the more, I would say, a regular model? Like how the appointments and maybe even during labor and birth, what are the main differences?
Yeah, I think the main difference is that you really build on a relationship together, and that takes some extra time. So the frequency of the checkups, I think, is almost the same as regular practices, but most caseload midwives have on average an hour for a consultation. And compared to 15 minutes in a regular practice. And at our practice, we do almost all the prenatal checkups in a home visit, and not in a practice. And that home visit is, well, the medical checkup, so blood pressure, and we check the growth of the baby, of course, and organize the medical stuff. So maybe you need some blood checks or an ultrasound. We refer to an ultrasound center And then we have a coaching interview, talk about how you feel, and that's more personalized and more deeper actually. So it depends on your issues. Maybe you are questioning your past, or you have trauma of earlier birth. Maybe you see some patterns in your life which you want to examine, and that makes it more like deeper relationship. And because of the relationship, there's something growing of trust and confidence, self-confidence towards birth.
Absolutely. And is it accessible to every woman or pregnant people, caseload midwifery?
I think there are more women who want caseload midwifery compared to the amount of caseload midwives in the Netherlands. For us here in Amsterdam, we are kind of new practice and we have some space, but I hear from a lot of women it's hard to find a caseload midwife. And then most caseload midwives ask an extra payment for their care. So it's not accessible for people who have difficulties to pay that. And I think one of the main problems is that a lot of people don't know that they have a choice. So they just visit the closest by practice and don't know that there are some differences between practices, and especially big differences when you compare it to caseload midwifery. So hopefully a lot of women make a good decision about what they want to choose.
Yes, and so we talked about the prenatal care. How about during labor and birth? And I think my question is also, is caseload midwife, a caseload midwife, how do you say this? Oh my God. Can you have a caseload midwife both for home birth or a hospital birth, or is it more, is it better for either or? Birth?
It's a good question. It's good and best for both, so that doesn't matter, but you have the highest chance of a successful home birth and the most natural hospital birth with a caseload midwife. So there's a lot of research. It's shown that you don't have a difference in outcome for like medical outcome, for example. There's no difference in perinatal death of the babies, but you have less interference in birth when you have a caseload midwife. So that means you have less chance of have instrumental delivery, for example, with a vacuum delivery, and you have less need for analgesias such as the epidural. So you have bigger chances of a healthy delivery with a caseload midwife compared to other type of midwifery or obstetric-led care.
And that's good. That's very good. And so if you, let's say, plan for a home birth and then you go to the hospital, does the caseload midwife stay with you all along? Yes.
Yeah, that's a huge difference as well. Like the regular practices, most regular practice, when they refer you to a gynecologist, when you need some extra care during birth, on certain point they leave the birth team and let it over to the birth team of the hospital. And a caseload midwife stays with you more as a doula and is more acting to build a new team around you in the hospital and try and make sure that your autonomy and your shared decision making is guaranteed in the hospital as well.
And this is very important, I guess. And for those who are not really familiar with the system here, so you mentioned continuity of care, and this is quite something that is important. And so, can you explain what it means exactly? And for those who don't know what prenatal care is in general, what is the difference?
Yeah, it's easiest to explain from practice point of view. Is, for example, when you work in a team with 6 midwives, you need to make plans together with the 6, how you create your care, how you act during birth. So how long do we stay? When do we visit? When do we do a vaginal examination? When do we refer to hospital? So that means that the bigger the teams, the more protocolized you start to work. And with bigger teams, you have sometimes a click or a match with a midwife you met in prenatal care. But most of the times you see every midwife 2 or 3 times in a pregnancy.
Yes.
So based on that short visits and not very frequent with the same midwife, you have to trust that she's feeling and knowing what your wishes are and what is good for you. And you have to feel confident to let yourself go during birth.
Yes.
And well, when I explain it, maybe you feel a bit, that's not really optimal.
Yes.
So when you have 1 or 2 midwives and you see every time the same, and you see them for a long time and you know each other, it's easier to have confidence and to let yourself go and to ask help or to say, don't touch me, or please can you touch my back during birth, or leave me alone, or can you stay with me, or oh, I grab a cup of tea and we feel familiar together and I'm not interfering in the birth process. And all my colleagues in like the regular practices are really kind, and they're really good educated midwives in the Netherlands, all of them, and they're caring. So it's not that they're bad midwives, but the system is not optimal for all the pregnant ladies because they are seeing too many faces. And when you change it to more continuity of care, you see results, medical results of more health positive health results, and more satisfaction with future moms when they give the continuity of care.
Would you like to tell us a bit more about these benefits actually of the continuity of care? What are they concretely?
Yeah, well, concretely, you have less preterm birth when you have more continuity of care around you. We don't completely understand how that works. Yes. We think it's like a stress buffer, like it reduces your stress levels, and that's influencing the chances for preterm birth. What I said before, you have less instrumental birth when you have a caseload midwife. So that's, for example, the vacuum delivery, and less epidurals. Without risk, there's no more disadvantages. So it's all good that I think it's good that we have all the things like epidural and C-sections. It's nice that we have it when it's necessary, but when you overdo it on healthy women, you have some disadvantages.
And you mentioned instruments. Is it common here in the Netherlands to use instruments during birth?
Well, with your first baby, you have a risk, the highest risk of instrumental delivery. And we know when you have a team around you which is seeing birth and acting with more risk-minded orientation, there is it's more likely that people will interfere with birth process. So when you are feeling and are healthy pregnant and your delivery is normal and it started spontaneously, you have the less complications when you stay out of a completely medicalized environment, actually.
But is it actually like a caseload midwifery? Is it more indicated for some types of pregnancy, or is it basically for anyone who would like to have the same midwife for the whole adventure? I would say.
Yeah, I think the benefits count for all of us, but some research from the UK showed us that it is more benefit when people are like living in more stressful environment and have some certain socio-economical problems. But actually that is a big gap between the people who need it the most and who have access to it. So, but I think everyone who feels like this journey in my life, it's making me unbalanced, and I feel somewhere that I take some, I need some extra time and guidance to this process. I think only that you feel like there's something, that's a good reason to choose a caseload midwife, because it's always helpful on certain levels of spiritual, like emotional, psychological, physical. Yeah.
It's funny because it's actually not funny, but I only very recently learned about caseload midwives, but I feel like it's really it should be. And I talked with many other women, already mothers, who also didn't know about it, and it's kind of a pity because maybe if I'd known, but. So for anyone who is considering hiring a caseload midwife, how can you find one? How?
Yeah, well, you ask Google, caseloads, verloskundige or midwife. We have an organization, it's called Geboortebeweging, and they are gathering some information about this type of practices as well. So a lot of women find a caseload midwife on that website too. And yeah, hopefully when more women ask for it, the more practices change their way of care towards this, because I think it's better for everyone. But yeah, when you don't know about it, then you cannot find it. But when you Google on caseload midwife, then you can find it. I hope so.
And is it a bit the same, like, because you hear a lot of so when you are pregnant, so obviously you can choose any practice you want, but sometimes you can also hear that it's best to choose a community midwife that is not too far from you, because maybe you won't you won't be available if you are sent to well, if she's too far, basically. Is it the same with caseload midwifery, or you can go to any perimeter, basically?
Yeah, that's a good question. I think it depends on which area in the Netherlands you live. Most caseload midwives have like a maximum of 30 minutes drive for your birth to your house. It's not always in every area possible, of course. It is more easy when you have your midwife practice and your ultrasounds and stuff close by. On the other hand, for example, when the caseload midwives coming to your house as well for certain visits, then both of you need to travel a bit for each other. And it's even when you choose your like regular midwifery practice, it's good to try to figure out, are there any differences between the practices around me?
And I think my last question is about the appointments themselves, because they are longer, right, than the appointments you would typically get with a regular midwife. Do you also prepare for birth during these appointments? What?
Yes, we do. Not with the birth preparation, as in really breathing techniques or mindfulness or hypnobirthing, not that type of preparation. It's more about expectations. Are there any fears, any issues from other deliveries you've done? So we talk a lot about it, and that's biggest preparation, of course. And some caseload midwives do some extra stuff they can do, like relaxation exercises or spinning babies or rebozo techniques. So I think it depends. Same as with doulas. You have as a caretaker, you have things in your backpack which you can use to give personalized care.
Okay, and after birth, there is also the typical visits from the caseload midwives too. Yes. Okay.
Yeah, I think then it's really an advantage as well to have the caseload midwife, because you know her and you go further on with your issues or themes in your life about parenthood, which were discussed in pregnancy as well. And when you have a bigger team, it's the shorter visits, and also with sometimes unknown midwives. So it's really comfortable and nice to have someone you know. For example, when you have some issues with losing control, and we have discussed it about how is it influencing your birth process. It's also a theme in motherhood, so it's a good one to to discuss after birth
Absolutely.
as well.
So yeah, no, actually I didn't realize, but then after birth you get again 1 hour appointments. So it's not just a short visit, or how does it work?
Yeah, well, I don't schedule it in hours. Sometimes I need 2 hours and sometimes 30 minutes, but
I see.
On average you have contact every 2 days, and you have 3-4 visits, and when it's needed you go back after 3 weeks, and we plan a postnatal checkup around 6 weeks as well. But it's personalized, so it depends.
That's really nice. Oh, that's awesome. This sounds really good. So you've been a caseload midwife is your practice, Kairos Collectief. Would you like to tell us a bit about the practice? Maybe?
Yeah, we are based at kairosverloskunde.nl. We are Amsterdam based, and around Amsterdam welcome as well. And we work in a combination of 2 midwives. So the caseload is a duo of 2 midwives, and we work with 2 duos. So we have a system that some months when we are on call for deliveries, you always have your own midwife when you have to deliver. You always see us for prenatal checkups. And I'm really glad that some other months of the year, the other duo is taking care of the deliveries, and they have their own caseload, and I'm off the on-calls. So that's how we work to keep, because a lot of caseload midwives are working for 3 to 5 years, and then they have to quit a job because it's really hard to have that on-calls 24/7 when you have children of yourself, or it's like a mentally availability. So we try to find a rhythm that we take care of ourselves as a midwife as well.
And that's very important. But thank you so much for sharing about your insight and expertise about caseload midwifery. I think it was very insightful and very valuable for many people who don't know, and we got the comment as well. If there are any questions, I think we have just a little bit more time to answer them. But otherwise, so this live has been recorded, and I will share it along with all the contact details of Caroline and the Kairos Collectief. If I can ask you one last question, Caroline, what would be your golden advice for expectant parents who are listening to this interview?
Yeah, I think be critical and speak up to your caretakers. Midwives, gynecologists, whatever. So try to figure out what is important for me, and do I feel that I have the space here to get the care that suits me. And if not, try to look further. And if you're really satisfied, it's good and it's nice. But when you feel, I'm not sure, do I really feel confident to give birth with this birth team, and do I not really feel confident with the advices or with the plan which is made for me? Then just ask questions and open the conversation, because you're worth it, and your gut feeling about the process is always right when you're pregnant.
That's a great advice. Great advice. Thank you so much, Caroline. We didn't get any questions in the comments. I'm just checking real quick. First time I hear about caseload midwife. Okay. Yes, that's very true. So we don't have any more questions. Yes, we had a question from Cosita. Why is it so important to prepare for postpartum if you didn't do it before? We actually have a live conversation about that too. But do you have an answer for this, Caroline?
Yeah, it's strange. Well, I think normally you prepare till birth, okay, then the baby's out and then my job is done. And some people forget that it's important to prepare for what's happening after that. And for example, breastfeeding is really important to gather some information about, or do a course or read a book. And the same is how do I react on my family and system around me? Is it nice to have them close by, or do I need some time for myself? Who can I ask for help? I think that's really important to think about in advance, to be relaxed when the baby is there. It can be overwhelming just because of the lack of sleep, and all the new adventures in those first weeks. So yeah, my advice is prepare yourself to reach out. You don't have to prepare all with courses and stuff, but fill your freezer with some soups and ask friends to help.
Fantastic advice, and that's very true. Like many people will focus on the birth plan, but there is also a lot that can be done in postpartum planning. I hope this answers all the questions. Thank you so much again, Caroline, for coming here and have this little chat with me. Thank you to everyone who watched this video, and you can watch it again on our YouTube channel at parentally.nl. That's it. I wish you all a very good day, and thank you so much for watching, and see you next time.
Thank you for listening.
Bye. Bye. Thank you, Caroline. Bye.